Hi, my name is Kelsey, and today I'm going to be going over 5 different programs or tools that you can utilize to help save you money on your Medicare prescription drug costs. Tool number 1 you can use is by shopping plans. So I don't mean to insult anybody's intelligence with this one. I know it is a pretty basic concept, but there are people who are new to Medicare and wondering the same thing. Or maybe you're one of those people that I've spoken with in the past that pays for their prescriptions out of pocket anytime that you need one. So I do want to go over some basics. One reason why you need to shop for plans is because the federal Medicare program that's provided through the government, they do not provide you any prescription coverage automatically. So prescription coverage is actually something you need to take out through private insurance, and they call it a Part D plan. And you can think of Part D, D is short for drugs. Now there are going to be certain times of the year that Medicare allows these insurance companies to actually get you enrolled into their prescription plans. So the most commonly used enrollment period for getting into a prescription plan is called your annual enrollment period. So this enrollment period, you can use it every year, and it runs from October 15th until December 7th, making your plan become effective on January 1st of the following year. However, there are a variety, like a whole long list of other special enrollment periods that someone may qualify for, like if you move, for example. And those enrollment periods can get you a prescription plan at other times throughout the year too. Now, one way that may be easiest for you to compare different prescription plans that are available is by going onto Medicare.gov, and they do have a Medicare RX tool that you can use. And what this tool does is you link in prescription names, dosages, quantities, as well as the pharmacies you may want to use, and then it will bring up each plan that is available in your area and give you some estimates of what the prescriptions may cost under those plans and with the different pharmacies you are asking for. And I'll be sure to link that down below so you can click and get there directly. Now, the Medicare RX tool will give you monthly and annual estimated prescription drug costs. So that's a really great way to give you that big picture outlook on what you may need to budget for these types of medications that either you have been prescribed or you're just curious to look up for the future in case that is something you need. And another good thing to keep in mind, if maybe you're taking some high cost prescriptions or just a lot of prescriptions that you anticipate maybe needing throughout the year, is to also look and see if there's a plan in the area that will offer extra prescription help throughout what's called a coverage gap. Now, I know I'll probably make another video in the future too about what the coverage gap is and what you can expect for that. But today, just understand, if you're not familiar with that concept yet, the coverage gap is something that most Medicare Part D plans do have. And for most people, that just means higher prescription drug costs for you if you were to reach that throughout the year. So of course, if a plan's going to give extra help throughout the coverage gap, that could mean a lot of extra savings for you as well. All right, now tool number 2 that you can use to help save prescription costs here would be by utilizing a manufacturer-provided assistance program. These are programs that are provided directly through the manufacturer that makes your prescription drug. So not every medication that's out there has one of these, since there are literally thousands upon thousands of medications. But a lot of common or high-cost medications do have an assistance program out there. So another thing that I'll link down below is a link that will take you to a search page on Medicare's website that also gives you a list of every single medication name that has a program. You can search by the name or the first letter of the prescription name, and it'll take you directly to the information on that manufacturer's program. Every manufacturer assistance program has a little bit different rules on how you can qualify, as well as how much assistance they're going to provide you once you do qualify. Alright, so tool number 3 is by using a state pharmaceutical assistance program. And those can sometimes also be called a SPAP. So SPAP programs, since they are provided directly through your state that you permanently reside in for at least 6 months of the year or more, they are not going to be available in every single state in the United States though, unfortunately. And just like how the manufacturer programs have different rules for how you can enroll and apply, the state programs all have their own state-specific rules as well. So I'm going to look down at my notes for a second to go through every single state or territory that does have a state pharmaceutical assistance program already in place. So that way, you know, if you're one of these states, you're already off to a good start. This is going to include Colorado, Connecticut, Delaware, Idaho, Indiana, go Hoosiers, Massachusetts, Maryland, Maine, Missouri, Montana, North Carolina, New Jersey, Nevada, New York, Pennsylvania, Rhode Island, Texas, Virginia, the Virgin Islands, Vermont, Washington, and Wisconsin. I will link down below again a link to Medicare's website page that will take you to different websites or phone numbers where you can apply for your state's SPAP. Now, one thing that's interesting to note too is that some states' plans will ask you to keep your Part D prescription plan in place while you receive assistance from the state. So that way they can coordinate together. Your Part D plan usually pays first, and then the state pharmaceutical assistance program helps coordinate with that and pay second towards some of the out-of-pocket costs. However, there are some states that will have an assistance program replace your Part D plan. So you do want to contact your state and their state pharmaceutical program if you qualify, and just double check and verify whether you need to have a Part D insurance plan in place with that too. Alright, way number 4 is going to be a low income subsidy. These many times are just called LIS. So what low-income subsidies are going to be programs that are provided through Medicare and Social Security. For a low-income subsidy, in 2018, which is the year we're in right now, a person who qualifies for LIS will pay no more than $3.35 for each generic medication that they take, or $8.35 for each covered brand name prescription. Now, if you do find that you qualify for LIS, then you do also want to be sure that your Part D plan stays active, because LIS needs that Part D plan to be in place first, to pay first. One thing you can definitely do if you qualify for LIS and you find out that your insurance company doesn't help with the prescriptions that you need, by qualifying for this level of extra help, you also qualify now for a year-round special enrollment period, which basically means to you regardless of the time of year, regardless of the number of medications or their costs. You can keep switching your plan to whatever plan's available in your area that best suits your needs. So that's a huge, huge help for a lot of people. Don't worry if your prescription plan doesn't cover all of your prescriptions if you qualify for LIS. You can change it, and you should, because you can change it whenever. It'll just start the following month after that. Okay? And the fifth way that you can save money on your Medicare prescription drugs is by qualifying for Medicaid. So Medicare and Medicaid, I know they sound really similar, but they're completely separate and totally different entities. So what Medicaid is, it's something that's provided federally and through your state Medicaid program. And this is going to be specifically for someone that has a limited income and resources. So it is going to be the highest level of extra help that you can receive in most instances. Now, if you do apply for Medicaid and you get accepted and you don't have any prescription plan already in place, just be aware that the state Medicaid program and Medicare are going to go ahead and automatically enroll you into a plan at that point. But just like the LIS, if you qualify for Medicaid, you can change your plan at any time throughout the year. Now, the really neat thing about number 5, Medicaid, is that this is a type of program that not only helps with your prescription drug costs. This can also help with your Part B premiums. It can help with your medical costs, like if you have to go to a hospital or each time you see a doctor. And it can also even help with items that are not normally covered by Medicare, like routine dental and vision in some states or for some levels of Medicaid. So it's a really, really good help if you have limited income and resources to give you a lot more benefits and coverage per se without any additional cost to you. Well, I really hope that you guys have found this video to be informative and helpful to you, and feel free to like this video if you really enjoyed the content, or share it with a friend if you think that they could benefit from some of this information as well. I would love to hear your comments below if you do look into these programs and get some savings. Thank you guys so much for watching. I hope you have a great rest of your day. Bye!